And I guess another question related to that is, of course, it's a good idea to have insurance cover those big catastrophic items. And I agree with you. Why are we insuring something that's affordable? Like that makes total sense. Why do we have to have insurance to pay for something that shouldn't cost that much?
And putting the cart before the horse, I think we've always done that wrong, that you need insurance to get care, right? You need to pay $1,500 a month premium to get metformin that costs 2 cents a pill, right? I mean, not even, I can buy 1,000 metformin for $13. What are we doing here, right? And the application of good psychology is getting patients to understand that if their meds and their lab tests are more affordable, then it's easier to invest in their long-term preventative health. If it's not transparent, if it's difficult, if it's expensive, they're going to push those things back later into the future, and that'll create problems. So um, the business model combining with the psychology of how to change patient behavior, the lower the price, the more compliant they are, the better the outcomes we get.
Like you say, why pay a really expensive premium to insure something which, 95% of your care really probably could be done at your primary care doctor's office. If you don't have to insure that because it's not so expensive, maybe we don't have to have insurance be this thing that's supposed to catch everything. And then you don't maybe leave quite so many people out on the back end. Because I wish everybody had access to some sort of catastrophic insurance
Yeah.
because you get a car wreck, you get cancer, you get some sort of horrible diagnosis. You're going to be in the hospital. It's going to cost more money. But like you say, why do you have to spend so much money just for access to be able to take care of your basic metabolic syndrome sort of diseases where a lot of the medications, especially the ones that have been around for a while, they aren't very expensive. And the
I think often we get sort of typecast or pigeonholed as anti-insurance because we don't take insurance here, but we're really just more pro-efficiency. We can get to a point where you make 80 to 90% of care 80 to 90% cheaper. Now, the question of insuring everybody gets so much easier because I don't really care who pays on some level. Should they pay $100 for a CBC when we can get it for two? Absolutely not. So it makes the purchasing power of the money we put into healthcare 10x better, but it also means we can cover more people less often. And so the problem to solve is that we want people to use less insurance, and doctors struggle with that because the general way we thought for forever is more insurance is more better, right? Like we have the dog that doesn't bark type things that where we don't appreciate that there's a significant financial harm to patients and their families and their lives if we keep trying to just use this blunt tool of insurance for everything.